Welcome to Head On. I'm Paul Winn. Tonight we have a very interesting subject of discussion about pain, something that I think everybody in the audience has experienced at one time or another. And we have two guests with us today that are going to enlighten us about a syndrome of pain that before this opportunity I knew nothing about. And to help me understand a little bit more, I'm introducing you to Jennifer Morley.
Hi.
And Kate Palmer.
Hi.
Hi. And this is I find really interesting because it was this, pain, of course, as I mentioned, I think everybody's experienced it at some level or other in their life, scraped knee, or worse. Maybe you could explain to me a little bit about this complex regional pain syndrome.
Yes, well, complex regional pain syndrome is it's actually considered a rare disease, and it happens in approximately 7% of people who might have something like a limb fracture or some other trauma to a limb or even a surgery to a limb. And what happens is they start experiencing pain out of proportion to the injury itself. So the pain can be described as like a burning pain, or some people have stabbing pain, but it's usually constant 24/7. And that pain has the ability throughout the course of the disease in some CRPS sufferers to spread throughout their bodies. So in both Kate and my case, that has happened. So it starts for me, it was my shoulder, and now it's spread through most of my body, definitely my upper arm, both my arms and my legs. So, it's a very painful disorder that just develops for no real known cause. That's part of the problem with CRPS, is that the research is still very varied, even though the disease has been around for a significant period of time. It dates back to even with the Civil War, where the veterans and stuff would have injuries, and it had different names back then, and the names have changed throughout the understanding that they have of the disease so far. In order to call it complex regional pain syndrome, it's because the researchers and medical community understand that there's so many complex layers to the disease. It is a disease that affects the nervous system of the body. So it's, we experience central sensitization of the nervous system. So our nerves are essentially misfiring and reading pain signals to be much more intense than they should be.
So is there no relief for this system? I mean, it must be, I don't know how one can carry on their day-to-day life if that's the case.
Again, not only is the disease complex itself, but how it presents for different people is also quite varied. So depending on, there's a lot of different factors that would influence an outcome for a person who develops CRPS. So age would be a factor. The younger you are, the more likely you are to have a better prognosis, and how quickly you're diagnosed also impacts significantly whether you are able to get to a resolution of the symptoms. So CRPS, technically, there's no cure for the disease, but people can go into remission. And if people are diagnosed within 6 months is usually the kind of time frame that the doctors hope to be able to diagnose and treat the disease, then people actually have a fairly good chance at getting to a place of having no pain or little pain. But that's not always guaranteed. So for those of us that have developed so we would call that an acute CRPS. And then for Jen and I, we have passed the acute stage and now would be considered to have chronic CRPS. And so for us, there has been no relief. For me, I've had times of remission, but I've been in this kind of pain for the last almost 3 years, and Jen's working at almost 6 years. So for us, there isn't a lot of relief. They don't have a lot of treatments that are effective for CRPS that is chronic. And although some treatments provide some relief for us, we still are in tremendous amount of pain all the time.
But like until I saw a memo, from you, Jennifer, that I've never heard of CRPS.
No.
I had never heard of it, and now there's going to be an opportunity for people to learn more about it. You have a fundraiser coming up in what, August the 10th? No, 31st. August the 31st.
August 31st.
Maybe you could tell me a little bit about that.
Yes, so we're having the first fundraiser for our foundation, which the foundation we started just in the spring, so it's still relatively new. And our fundraiser is going to be, like you say, August 31st at 7 p.m. at Bevan Park. And we are selling tickets, and people will, with their ticket, will be able to come and watch a documentary that's we've received permission to show. It's done by a producer named Charles Maddox. He's actually the nephew of Bob Morley, and he's produced this film because his mother has suffered with CRPS, and so he couldn't just stand by and do nothing. He felt like he had to do something and teach people about the disease, and so he wanted to hopefully get a movement going, a movement of awareness, because like you said, so many people don't know about it or have never heard about it. So we're going to show that film. We're also going to have a...
Is that Trial by Fire?
It is Trial by Fire,
okay.
yes, that's right. And then we're going to have dessert and refreshments. We have an amazing silent auction. We've really had a great response from the community to donations for that. We also have a resource and networking table where people will be able to get copies of our first 2 brochures that we've produced, one which is about sort of a little more about CRPS, and the other one is for the CRPS patient. And then we're actually in the process of designing a 3rd brochure, which is going to be for the loved ones of the CRPS patient. So we're going to have a bunch of different articles available as well, and we have a PowerPoint presentation that'll be looping throughout the evening with information about the disease. So yeah, it's going to be a great night. We have tickets for sale through our website, through our Facebook page. And so yeah, we're just hoping to, we've sold about 85% of our tickets already. So we've had a very good response, and we just hope to get as many people there as possible. We've actually released a few extra tickets, pushing the limit to the maximum the room will hold, but in order to get as many people from our community to come and see the film as possible.
I got a feeling that I mean, you're gonna probably touch every household in Nanaimo. I mean, there may be somebody. I mean, it may not be CRPS, but the fact that they may be experiencing pain. I know a lot of old folks who get up in the morning and say, "Gosh, my back, my knees, my elbows, my ankles." I mean, I don't think they're suffering from CRPS, but they do know about pain. And I think that to help get the message out, I think it's good that you're having this open house, and it starts at 7.
Yes.
And what time from 7 to 10 is
Approximately 10 o'clock. Yeah.
Okay.
The movie we're showing is about an hour, so we have some time before and after to kind of do the other things that we have planned for the evening. But
so there'll be a question period, I guess, that people can ask.
Well, Jen and I are each going to take an opportunity to briefly tell a little bit of our own stories of how we have come to cope with, or not cope so well with, CRPS at times, and then, of course, having a chance to network with some of the people in the room, and share the resource table and make sure people have an opportunity to participate in all the different parts.
Yeah, I mean, I just, like I said, I just never thought about pain. I mean, because as a person, I've had some pain in my life, but it's been short term. It's as a result of a blow or a broken bone or something, and then over a period of time it disappears. But I couldn't imagine living with something that I mean every day.
Well, that's one of the things about CRPS is it's not really a disease that's very easy to explain, and it's not a disease that is really something that people can imagine having unless you live it. So one of the things we often hear is, how do you function when you're in that much pain all the time? It's kind of an area of where we get questioned, like, how is that even possible? And the reality is that we don't really have much choice. Yeah. we're both mothers of children who require us to be there for them and present for them. And, you know, you can only writhe around on the ground for so long waiting for the pain to stop. But with CRPS, it doesn't.
No.
So at some point, you just have to get up and go. And one of the differences, I think, is that, you know, when you have pain that you don't know what it is, you'd head to the hospital.
Right.
But because we know that our pain is because of CRPS, it allows us, it doesn't mean the pain is any less intense or difficult to deal with, but it means that we're not as, I guess the fear is not there, so we don't, you know, take ourselves to the hospital on a daily basis.
That's right.
Because they always ask you, you know, you go to the hospital and say, well, from 1 to 10, what's your pain?
Yes.
44. You know, like, I mean, it's, I can't, I mean, I don't know how to describe pain. I don't.
It's a very subjective experience, and it changes. Like my 10 when I, you know, first started is probably like a 5 now, because
Absolutely, that's my experience too.
I've had
It's
pain.
been a bit of a reduction.
No, I mean that what I thought was a 10
Oh, I see.
got so much worse that if you had to stick to a 1 to 10, it would then all of a sudden be a 5, because it's gotten so much worse.
Use the McGill scale and tell them I'm at 47.
Yeah,
You know?
exactly. Sometimes it would be nice to be able to do that. Yeah, exactly.
You know, familiar with the McGill scale? This is where I am at. You know, because when I looked at that, and the, you know, here is at the top of this scale, which is maximum is 50.
Yeah.
And I saw the CRPS, and then I saw
There's amputation,
childbirth,
yeah.
amputations, gallstones. I mean, and they're like down here at the bottom of the, you know, the scale,
Yeah.
and it's
Yeah,
CRPS is considered the most painful medical condition that people are aware of.
and it's hard. I think one of the things we'd like to express through our foundation too is the fact that a lot of people say, well, how can you sit there and smile, or you don't look like you're in pain? And as Kate said, you know, we don't really have a choice. We can either choose to live our lives or keep secluded, which isn't any help, because the being in that much pain also leads to severe depression. And with that severe depression, if you don't sort of continue on with your life as much as possible, that can cause a lot of problems. And the CRPS has actually been nicknamed as the suicide disease, because so many people can't bear to live with the pain that they choose to end their own lives. And we just don't want to see that happen, you know. And so our goal is to raise the awareness so that we can let people know what it's like to live with CRPS. Yes, we're sitting here and we may crack a smile, but inside we're in excruciating pain. It feels like, you know, you equate it to like the Fort McMurray forest fire burning, when you saw those visuals of the cars driving through and the flames up on the side. That's what it feels like inside of us all the time, 24/7. Like, I personally have not had 1 second free of pain since October 2011. And, you know, we look at that and we go, I can't spend every day on the floor praying that it'll stop, because it hasn't. It hasn't. Yeah, exactly.
You know, like you were saying, you got to live your life, and your mothers.
Yeah.
You've got children who are going to make
That's right.
demands on you. You can't say, "Go away, I'm in pain."
Exactly.
You know, like it's.
They're not very. They don't understand.
No, right. I'm sure, and it's and like I like to think I'm a relatively aware person, an educated person, and I tend to read lots of things, you know, just out of interest. I had never heard of CRPS. And I mean, you know, because like, I mean, I've heard of people say, "Oh, I went into the hospital, I had a gallstone,"
Right.
Or, you know, saying, "Well, why is that? It was terrible." But then, of course, it's gone. The gallstone gets passed or broken up, and then you're pain, and you're back to your regular lifestyle.
That's right.
But I just, you know, I mean, I think that the workshop, or not, I shouldn't say the workshop, the fundraiser and information session you're having on August the 31st, you know, is going to be invaluable to a lot of people to get there and understand, and maybe it'll start to, you know, spur some interest in trying to find a way to offer relief
Absolutely.
for people to, you know, who have the disease.
Part of the reason we started the foundation was, one, our main focus is on increasing awareness for the general population, but also within our medical community to make sure that that they are aware of the diagnostic criteria, as well as making sure that, because how early somebody is diagnosed has a huge role in the outcomes for them. You know, if people are receiving the diagnosis in a timely manner, then they're more likely to not have to live the rest of their lives in the kind of pain that Jen and I do. So, but not only is awareness alone enough. Without the awareness, there's no research.
Right.
Without research, there's no treatment. And until we have evidence-based treatments, it's going to be very difficult to access those treatments.
Absolutely.
Yeah, because that's important, because as we know, you know, with other diseases that we have that have had successful, you know, campaigns, fundraising campaigns, what comes to my mind is, I think of young Terry Fox.
Yes.
They say that, you know, because of the amount of money that has been plowed into cancer research, that he would not have died from the disease that killed him if he was around today, because the research has been so successful. And so that's the kind of thing you know, you can hope for CRPS, is that, you know, get some funding into there, get people doing researches, and they might find blockage, you know, like how do you block it, if nothing else, to allow some kind of reprieve so you can, you know, do normal things without
There's a
pain.
lot of unanswered questions right now. Like, we don't know how many people in Canada have CRPS. We don't even know the demographic information about who they are and how they came to have it. So was it a fracture? Was it a surgery? Did they have a, you know, disc issues or sometimes an infection can be the cause, or sometimes it's just spontaneous. So we don't have any of that information, but we also don't know why one person who breaks their arm has a normal resolution and the other person develops CRPS. We don't know the mechanism as to why the disease spreads in some people and not in others, or why somebody goes into remission and the other person moves on to chronic. So there's a lot of unanswered questions with CRPS that we have to get answered.
Yeah, it'd be nice to compare those people that go into remission and find, you know, to be able to do some studies with them versus those that are continuing to experience the pain. So they'd say, okay, well, was there a lifestyle change? Was there, you know, their diet? I mean, you know, I don't know. You know,
there are so many possible factors. I mean, one of the things about CRPS is it was originally, its name previous to CRPS was reflex sympathetic dystrophy. And the reason they named it that was they thought that it had solely to do with a malfunction in the an overactive sympathetic nervous system. They changed the name to reflect a new understanding that that CRPS actually involves multiple systems in our bodies. And so when you think about how many systems in our bodies actually malfunction with CRPS, and how many factors could potentially influence those, the possibilities are endless. And so, the research is falling short on being able to explain any of those.
You know, I think of people that I know that have sciatica.
Yes.
You know, and their discomfort with sciatica, I mean, and it's something that they have opportunity to get relief from, you know, and to get it fixed up, if I can call it that. I couldn't imagine having your disease and not having anything that, you know, like you say, I mean, it could lead people to suicide.
Absolutely.
You know, because you say, well, what am I can't take it,
And you know, I don't know about Jen, but for myself, I can't tell you the amount of days that I said, I can't do this anymore. And somehow I have had to dig deeper on millions of occasions to find the strength to get up and to do what I need to do in a day.
Well, you can't give up yet, because you're going to get this fundraising going. You're going to increase knowledge around the whole community, starting in Nanaimo, and then next thing you know, you guys will be the Terry Fox of CRPS, you see, and you'll get this thing so people will know about it, to spur researchers to do some research. And I think that's, you know, because you're right, the only way you can get things done is if you bring attention to it and with an impact that there's enough force like by numbers of people that says, okay, hey, look, we want to know more about this, and we've raised this money and we want to put it into research.
That's right.
Would they have facilities in Nanaimo to start that kind of research, do you know?
I don't know that we have the right facilities here to do that research. I think definitely some of the data could start being collected. You know, Kate and I were talking about that on our way here, but just possibly even through our foundation starting some even surveys just to see if we can find some links in some of the factors, like what age they were at the onset and, you know, where it's first occurred and what part of their body, you know, and just see if they're, and how, like what was the reason for the cause, like did it start from a fracture or was it surgery or, you know, spontaneous, you know, so if we could get some of that data, then research will probably maybe have to be done in bigger centers, you know, places like UBC in their medical research. Part of their education for their doctors and stuff like that is maybe there's something that could be done over there to just get it started.
The University of McGill, I mean, I might be a good spot because you know they've developed this scale, which is in my mind is a bit of an indication that they have an interest in. Maybe they just have an interest in pain generally, but they've developed this scale and they recognize CRPS as the worst pain that a human can have, you know.
You know, the sad part I find is they recognize that, they know that from that perspective, but a lot of them too get discouraged and frustrated over the barriers in place because they don't know so much about it. And so a lot of times, I mean, not a lot of times, but on occasion you even hear some doctors say, well, there's just no hope, or I was told, you know, you have to, this is your life, live with it, just move on. And I'm like, well, yeah, how can you move on when you know, because it dramatically alters your life.
I think that's a stupid response, so pardon me, but I just think
but it's coming from our medical professionals, some of them, you know, so, you know, it's just getting that understanding out there that, you know, yes, right now it seems hopeless, but with action and with research and that we can make a difference. And, you know, we just have to be passionate enough about it, which Kate and I are, and about making a difference in the lives. We may not see the benefits of our work, but hopefully future CRPS sufferers will see. And yeah, if we do, that's that's right, that's right. So, you know, hopefully we can get that attitude changed and you know, not to have people, you know, hit that wall of frustration and say, okay, you know, I'm just done. There's nothing more I can do, you know. So, yeah, that's one of the big things in increasing awareness.
That, you know, like if there's a door people could go through for potential help, that, you know, that's a beginning. You know, like it's a sort of thing, and then the help inside needs to be developed. And you're right, the fundraising and to do the research is going to be crucial. Now, I just wanted to repeat again about the August 31st thing, because I think that it's important, you know, people in Nanaimo to get an opportunity to come out, you know, to Bevan Park and
We'd
see
love
what
to
you have.
As many people as we can sell tickets to for the size of the space,
And is
you
it
know.
$25?
$20.
$20.
Yeah, $20 each.
And yeah, and even though, like Jen said, we're at about 85% in terms of ticket sales. This is just our first.
Sure.
And it's a good step for us, and we're proud of how the event has come together, but it's just our first. So we're planning, November is Pain Awareness Month, and there's a specific week. There's a day, I think, do you remember?
Is it a national?
It's a national. The
Okay.
government has recognized.
Oh, that could be the death knell.
Has recognized, you know, and then there's CRPS has a specific day in November as well. I can't remember it off the top of my
I
head.
think it's November 7th.
7th or something. So we'll be planning an event again in November to continue our cause and And we hope with the funds, we want to talk about the funds that we're raising for this event, how they'll be used, because that's always an important
Sure.
question for people. So we'll continue the publications that we've started,
Yes.
and we'll also be using those funds to hopefully offer some of the physicians in town possibly in services.
Okay.
We'd also like to do some surveys, and then the last part would be to put up more posters and things in places where people who with CRPS might.
I would have thought like somebody like workers' compensation would be a source of information, you know, because they get patients who do have chronic pain, you know, not necessarily CRPS, but, you know, where they got pain that they can get a service for, or physiotherapy or something like that can give them relief. And then I would think something that just hit my mind was what you were describing to me is something that's described by people, military people, soldiers who've been,
Yes.
you know, in some kind of combat or situation like that, and then they come home and maybe because of amputations or something end up in constant, you know, pain.
Yeah.
So that might be another allied group that the researchers could start measuring and using as a baseline, getting a baseline. Yeah, well, we're running close to time here. But this has been really interesting to me, and I think you guys have done a really fabulous job of educating me, and I'm hoping the viewers have gotten an education and an idea and an interest in
Well,
what
thank
you're
you so
doing.
much for inviting us to
Yes.
come and talk about it. The more opportunities we have to talk about it and to share our stories about, I mean, it literally has been a devastating disease to try and live with and function with. And the more that people are aware of it and can offer compassion to those who suffer from it, then we as a foundation will feel like we've kind of made some progress.
Well, you say you have how old are your children?
Mine now are 3, 5, and 7.
Okay, and you have.
And mine now are 12 and 15, so they're
So
getting
yours might
older.
be a little more understanding.
Yeah.
I can have 3-year-olds.
Yeah.
When I was first diagnosed 20 years ago, and like I said, I went into remission and I've had reoccurrences, but this particular episode came back when my youngest daughter was only 6 months old, and I had no use of my right arm. So imagine caring for a 6-month-old baby without the use of my arm and being in excruciating pain.
I tell you, listen, I'm really hoping that August the 31st you get your full complement of tickets sold.
Thank
But
you.
apart from that, hopefully this show will give an opportunity for other people who have heard us and phone you, contact
Yes,
you
absolutely.
to get more information, because then, as you say, November's not that far behind August,
not,
you know, and then
We've been working
you
hard.
can get another session, and maybe you'll have 200 tickets
That's
to sell
right.
as opposed to just
Yeah.
80.
Absolutely.
Yeah.
That's our
Absolutely.
goal.
Well, look,
Yes.
we're kind of at the end of our rope here.
Okay.
I call it's not really a rope. It's really a lot of fun, actually. But I'd like to thank you both for coming out and sharing your story with us, because it's a very important story, and you know, maybe we'll get a chance to do a follow-up, you know, sometime
That'd be great.
after November, when, you know, if you get another thing happening in November, and then we can sort of do a follow-up and see what kind of input you had.
That's
Sounds great.
And
Well,
we
thank you again.
do have a newspaper article coming out on Thursday as well, so
Okay,
watch for
well,
that
we'll look
story.
for that.
Yeah.
Yeah.
Well, thank you very much
Thank
for
you.
coming, and thanks for your story. I
Thank
appreciate
you.
it. And to the viewers out there, if you have any ideas or suggestions for shows for the future, give us a shout. We'll be glad to have you on a head-on. Take care. Bye for now.